Knock, knock, knock.
Come in.
Good morning. How are you?
Good. How are you?
I'm doing good. I'm Zach. I'm going to be the nurse with you today, okay? Can you tell me your first, last name, and date of birth?
Lauren Crystal, October 23rd, 2003.
Alrighty, fantastic. I'm going to wash my hands, provide privacy. The doctor's ordered us to do a head-to-toe assessment on you today, okay? So already I've noticed that she's making eye contact with me. She is moving spontaneously. She's hearing me and answering questions appropriately. That's our GCS, our eye movement, motor movement, and verbal response. So our GCS is 15. I'm just looking, her head is symmetrical, skin is appropriate for her ethnicity, there's no lesions, no acne, anything like that. All her facial features are symmetrical. So as I go through this assessment, it's going to require me to touch you. Is that okay?
Yes.
All right. So first I'm going to start with the head. I'm just going to feel, palpate for any bumps, lumps. Does anything hurt?
No.
Okay. Hair is good, appropriate, looks healthy. She looks well groomed, dresses appropriately. Her head is round and appropriately shaped. Can you look up for me? Her neck is also appropriately shaped. Her trachea is midline. Her eyes are symmetrical, nose is midline, mouth is symmetrical, her ears are symmetrical on her head and appropriately shaped. I am going to go ahead and assess your ears, okay? So if you will, can you look that way for me? Okay, and let me see the other ear. Good, good. There's no redness, they're appropriately colored. All right, so next we're going to look at your eyes, okay? It's going to be a white light. Her pupils right now are at between a 4 and a 5. So just look at me. Okay. Alrighty, they're equal, round, and reactive to light. Can you look over? Look at the wall over here behind me. Look at my finger. Look at the wall. Look at my finger. Fantastic. Her eyes also accommodate to distance. Can you look up for me? Let me look up your nose. Appropriately colored. Can you open your mouth, stick your tongue out, and say ah? Alrighty, mucous membranes are colored appropriately as well as moist and intact. Alrighty, look up one more time. Give me a good swallow. Alrighty, swallowing is even, trachea is midline. Are you having any trouble swallowing, choking while you're eating or drinking, anything like that?
No.
Okay. This so normally in the clinic we would do this skin to skin. Every time that you feel my stethoscope touch you, I want you to take a big deep breath, okay? Good. Good. Listen on your side. Good. Pull your hair forward for me. Alrighty. Breath sounds sound good. No abnormal sounds or anything like that. Excuse me. Are you having a cough, any kind of mucus production, anything like that?
No.
Have you been experiencing any shortness of breath?
No.
All right. Well, I'm going to educate you on a couple of different devices, okay? So the first one is going to be this. It's called an incident spirometer. This is a device we use to help help us not get pneumonia, okay? So basically what you do is got a mouthpiece on it, and you're going to inhale, and there's a puck on it that would rise as you inhale, and we set a goal. Okay, I want you to get to that goal every time that you do it, and you're going to do this 10 times an hour, every hour while you're awake. Okay, does that make sense?
Yes.
Okay. Can you go ahead and show me? Good, fantastic. Go ahead and put that on your bedside table. The next thing is called a turn, cough, and deep breathe. Okay, so we're going to turn to the side. We're going to take a deep breath, and it's going to make you cough. Go ahead and show me. Great, great, great. Does all that make sense?
Yes.
Okay. Alrighty, go ahead and lay down for me. Alright, I'm gonna assess her skin turgor here. Make sure we're not dehydrated. Good, good, good. So I'm gonna listen to your heart next, okay? So in order to palpate to oscillate the heart, we find the sternal notch. We go down to the angle of Lewis and go directly to the right. This is the first heart sound, the aortic valve. Then we go directly across the sternum, still in the second intervertebral. This is the pulmonary valve. Down one to the Erb's point. Down one more to the tricuspid valve. Alright, and then the mitral valve is going to be in the fifth intercostal space at the midclavicular line. Alrighty. Your heart rhythm sounds okay. It's regular. It's nothing out of the normal, okay? Next, I'm going to palpate some pulses. Can I see your wrists? Right, I'm noticing that the skin temperature is appropriate. Right, your pulses are even with normal volume. I'm next going to check your ankle. This is your dorsal tibialis pulse. These are even as well, normal volume, and your dorsalis pedis. These are equal bilaterally with normal volume. So that's 3 of our pulses. We also have a lot of other pulses in our body, okay? We went over our radial pulse. We have a brachial pulse in your bicep here. You have an axillary pulse up under your arm, a carotid pulse in your neck, a temporal pulse on the side of your head, a femoral pulse in your groin, and a popliteal pulse behind your knee, okay? I'm not noticing any swelling, edema, anything like that. Her skin is dry in both the upper and lower extremities. Can you show me your fingers? Checking capillary refill. They both refill in less than 2 seconds. She has good nail and hand hygiene. Can you look that way for me? I'm going to look at your neck here, okay? And the other side. Fantastic. We don't have any jugular vein distension. Can you pick your shirt up for me so I can see your stomach? Alrighty. So I'm just inspecting. Everything looks symmetrical. There's no abnormal roundness or anything. Are you having any tender places in your stomach? Any kind of stomach pain?
No.
Alrighty. I'm going to go ahead and take a listen first, okay? We start in the right lower quadrant. We move up to the right upper quadrant. We go across to the left upper quadrant. We go down to the right lower quadrant. I'm going to flip my stethoscope over. I'm going to listen to the renal artery for a bruit, the other renal artery, and the abdominal aorta. Okay. Alrighty. You said you're not having any tenderness or anything like that in your stomach?
No.
Okay. I'm just going to press on it a little bit, okay? Okay, none of this is tender or hurting or anything?
No.
Okay, we're not guarding or... Alrighty, go ahead and sit up for me. Alrighty, are you having any, are your bowel habits regular? Are you going to the bathroom?
Yes.
You're not constipated or having diarrhea or anything like that?
No.
Okay, are we peeing enough?
Yes.
You're not burning or anything like that when you pee?
No.
Okay, fantastic. Next, I'm going to assess your muscles, your joints, all that good stuff, okay? Can you stick your arm out straight for me? if you will, flex your elbow. Go ahead and extend it. Alrighty, flex it against my hand. Good, extend it. Alrighty, I feel no crepitus, and the muscles are both equal in their of expected strength. Go ahead and flex this arm and extend it. Good, flex it again and extend it. Great, same for that side. All right, let me see this wrist. Can you turn your hand over for me? Great, go ahead and flex your wrist. Extend it, now hyperextend it. Good, flex it against my hand and extend it. Great, great, great. Same thing on this side, okay? Flex your wrist. Can you extend it? Hyperextend it. Good. Push against my hand and extend it. Great job. So the wrists are both equal in strength. No crepitus or anything like that. Next, we're going to do your knees, okay? Can you extend this leg for me? Go ahead and flex it. Good. Go ahead and extend it again and flex it. Great. And this side. Good. Flex it. Great. Push against my hand. And one more time. Good job. Go ahead and lay down for me. So the knees and muscles associated with that are no crepitus, and they're even and of expected strength. Okay. Can you go ahead and plantar flex this foot? Good. Go ahead and dorsiflex it. Great. Push against my hand. And push against my hand. Alrighty, same thing over here. Go ahead and plantar flex. Dorsiflex. Push against my hand. And push against my hand. Alright. Those muscles are also as expected in strength. Next we're going to do some walking, okay? Can you go ahead and stand up for me? I just want you to go ahead and walk across the room. Okay. Her gait is normal. Next, as you come back, I want you to walk heel to toe, looking directly at me, okay? Good, good, good. Go ahead and come over here and stand in front of me. I want you to stick your arms straight out. I'm going to make sure you don't fall, okay? Go ahead and close your eyes. Are you feeling dizzy? Do you feel like you're going to fall over?
No.
Okay, great. Go ahead and sit down. Are you having any chest pain? Have you experienced any chest pain? Any kind of funny feelings in your chest? Heart palpitations? Anything like that?
No.
All right, fantastic. Well, I appreciate it. The doctor will be in here soon, okay?
Okay.
All right.
Thank you.
You're welcome.